Hi, my name is Dr. Thomas Nguyen, and I'm a board-certified addiction physician. I like to go on to talk about nicotine use disorder. As we all know that every day 5,000 teenagers will take their first hit of their first cigarette. And in family studies, it shows that individuals who have parents or siblings who smoke are at a 4 times higher risk of developing nicotine use disorder. It is shown that 50% of genetics play into the role of initiating using tobacco or nicotine, and 70% of genetics play into a role of the continued use of nicotine. It is shown that in patients where they have a mutation in their dopamine receptors, that the nicotine that they are taking in is not creating enough dopamine to give them the full reward, because in this mutation the dopamine 2 receptors are diminished, so they tend to smoke more in order to compensate for the lack of dopamine receptors. Secondly, how nicotine is broken down is through the liver, and it is found that those individuals who have mutations to the metabolism or the breakdown of nicotine tend to have a protective effect. This is similar to the alcohol use disorders with the alcohol aldehyde dehydrogenase. So in these individuals, if they are metabolizing nicotine slower, the nicotine builds up quicker in their central nervous system. However, that does not enforce, that is not a reinforcing effect for them to continue to use nicotine. Rather, this is a protective condition where they are less likely to continue to consume nicotine if they have this deficiency in the metabolism of nicotine. And the same I could say about the genetic factors in the use of stimulants. As stimulants inhibit the reuptake of dopamine and other monoamines such as norepinephrine, so forth, and individuals who have lower receptors of dopamine receptors similar to nicotine, they seem to be more likely to use more stimulant or more cocaine in order to get the same effect, thus implying that in the long run they are more likely to develop stimulant use disorders because of the diminished number of dopamine receptors. I like to talk about opioids now because it is a major healthcare crisis in this country, even in 2024. But there are family studies to show that individuals who are children of parents who have opioid use disorders are again at a 4-fold increase in developing opioid use disorders. And the other thing about opioids is that, similar to nicotine and alcohol, is how they are metabolized. Again, opioids are metabolized or broken down in the liver. And those individuals where the opioids are not being rapidly broken down, that means that they have a higher buildup of opioids in their system with just a small amount of use, they are again less likely to develop opioid use disorders than those who do not have this mutation. And the same can be applied to the family studies and the twin studies to undoubtedly demonstrate that genetics play a major inherent role in the development of substance use disorder. So I hope this presentation will answer the curious question of that, why some individuals develop an addiction or a substance use disorders, and they're using at the same time as their friends and in the same amount, but their friends don't become substance use disorders because of the interaction, again, of the genetics, the environment, the individual's familial tendencies, and their life experiences. So today, I'm just focusing on the profound impact of the genetic contribution to those developing substance use disorders. I hope this has been informative and useful. Thank you for your time.